Good morning, Miss McGee. How are you?
I'm doing well. How are you?
I'm doing pretty good. My name is Monique, and I'm a student physical therapist at Florida A&M University. I understand that you have some swelling in your right arm. Okay, so what I'd like to do today is called compression bandaging, and I'm just going to apply the bandage and also verbally teach you how to teach someone else how to apply that bandage so that if you have a spouse or anyone around that can apply the bandage, that will be done.
Okay.
For this procedure, I will need to touch you. Is that okay?
Yes, it's fine.
Okay, well, I'm just going to wash my hands and go over a few contraindications just to make sure that this treatment is appropriate for you. Do you have any history of renal failure?
No.
How about any arterial wounds?
No.
A DVT at all?
No.
Have you had any cancer?
No.
Or any acute infections like cellulitis? Okay, well then it sounds like everything should be fine. I've already done your ABI and it came out to be 1.0, which is great. And I've also checked your blood pressure, which was 120/80, so that's perfect.
Okay.
And now I'll just do a quick skin sensation check as well as an integrity check. So I'm just looking at the arm first to make sure that there are any like cuts, bruises, or scrapes on there. And everything is looking good through the entire length. So I'll just do your sensation check now. It's just going to feel like a really light touch. And I would like for you to turn your head and close your eyes. And just indicate that you know that I'm touching you by saying yes.
Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes.
Okay, good. So that's perfect. Now I'm just going to go ahead and wash your arm and apply some lotion. This is non-scented lotion. You don't want anything that's going to irritate your skin. It's also mild soap. Now that that's applied, we can go ahead and start the treatment.
Okay.
Okay, so we're just starting with our small bandage. This is our hand wrap, and you want to make sure that this is rolled on your skin and not pulled. So I'm just going to start by anchoring it here at your wrist. And then we go out to the distal pinky. And when you wrap, you do overlap 50% of the bandaging. And we are leaving the nail beds out so that we can check your capillary refill after the application of this bandage. So we're just rolling it on. And then we go up to the next finger. You don't want to leave any spaces. If your bandage starts to get messed up, then you just roll it back up and start again. Always come back to anchoring at the wrist. Just a general tip for people applying this for you. Just tell them try not to fight with the bandage. Because it'll make it harder to put it on. Okay, and we're ready for our next piece. Sometimes we drop the bandage, we roll it back up. Just seeing another space that I need to fill in. Okay, so now that this is all on there to secure, covering everything and leaving the palm open, I'll just check your capillary refill real quick. Okay, and that's good. So next thing we're going to do is we're going to put on our sleeve. I believe this is pre-cut for you.
Mm-hmm.
So we're just going to go ahead and slide it on there. And there's a thumb hole, but we'll worry about that later or now. Okay, so now we're going to go ahead and start with our padding. And once again, this will be anchored at the wrist, and the same 50% overlap applies for this.
Mm-hmm.
So we just start right here. Go ahead and rest your arm. And when we get to this elbow space, we add extra padding here. And 50% overlap applies for this.
Mm-hmm.
So we just start right here. Go ahead and rest your arm. So when we get to this elbow space, you want to make sure that you add more padding here. So I'm just going to backtrack, make sure that you still end up just rolling on the bandage though. Okay. And now the second layer of padding is really just to even out all of this out. So I'll start at the wrist. Okay, and now that everything is looking even, we will go ahead and start with our next bandage, which is our 6-inch bandage. This is our short stretch bandaging, and you're going to always start by anchoring at the wrist, and this one is going to go back through your hand, and I'm going to fold right here at the thumb just for your comfort. And I'll go back through there. I'm going to make sure that the bandage is laying flat. I'll tuck it under. And the same 50% overlap applies for this bandaging. And to secure them, just use some tape. And then we start with our next size bandage, which is our 8-inch. We don't need to put this down at the hand. We'll just start on the wrist. Once again, make sure that you're rolling it on, or that it's being rolled on. Applying it. And this one's going to get a little tricky because we're going to get to your elbow up here. So we're going to do what's called a figure 8 when we get up there. And you're just going to go basically around the elbow for that. So can you go ahead and bend your elbow for me so I know that is good. So I'm going to go above it. And then below. Two times, and then just continue the same upward wrap. It's important that you always end going up because we're trying to promote that flow back into your venous system. And now for our final bandage, which is our 8-inch or 10-inch bandage. We always start at the wrist. %, always overlap. Okay, and then just secure this with tape as well. Excuse me. Okay, and that concludes the bandage. Okay, so now that we're done with the bandaging, I'm just going to check your capillary refill again, make sure that everything's returning good. And everything is fine, so go ahead and touch your shoulder for me and touch your nose. Okay, so range of motion is also good. Just a couple take-home points before I send you on your way.
Okay.
This I would like for you to wear all day, preferably 23 or 24 hours. So just to remove it to like get in the shower or brush your teeth, you know, just hygiene things in general.
Okay.
When you do your hygiene routine, we want to stay away from hot showers or baths. Make sure that we're using a low pH lotion like the one we used today, and definitely mild soaps. We don't want to irritate your skin at all. We want it to promote the blood flow to come back in every way possible. So even when you're like resting at home, if you just keep your arm elevated, that would also be great. Avoiding tight clothing, just anything that would, you know, kind of prevent the effectiveness of this treatment. As far as the bandage itself goes, you absolutely can wash this. We just like it to be in a garment bag and don't wash it with any bleach or harsh detergents. Again, mild soap. And then as far as drying, we just want to lay it out nice and flat and let it air dry, and then roll it up once it's completely dry. Do you have any other questions?
No.
Okay, perfect. Let me know how this works for you. I'll see you soon.
All right. Bye.